Question number 9. A 45-year-old woman presents with fever, pain, swelling of the right leg. She says that her right leg swelling has gradually worsened over the past 2 weeks, and she's also noted worsening fatigue and anorexia. 2 days ago, she developed low-grade fever. History is significant for diabetes, diagnosed 5 years ago and managed with metformin. Her temperature is 100.4, pulse 110, blood pressure 110/72, respiratory rate 16. On physical exam, there's painful swelling of the right lower extremity extending to just below the knee joint. The overlying skin is tense, glossy, erythematous, and warm to touch, and a diagnosis of cellulitis is established and appropriate antibiotics started. Which organism is most likely responsible? So they've given you the diagnosis. All you need to know is which organism most likely causes cellulitis and the characteristics. So is it a catalase negative cocci in grape-like clusters, catalase negative cocci in chains, no hemolysis on blood agar, gram-negative cocci with beta hemolysis, or catalase positive, gram-positive diplococci? They gave us the diagnosis. All they wanted you to do was identify the organism. Okay, so cellulitis and erysipelas, they manifest as skin erythema, edema, warmth. They develop when bacteria enter via breaches in the skin barrier. Fever can also be present. Some of the predisposing causes are trauma, pre-existing skin infection, immunosuppression like diabetes, obesity, HIV. So any alteration of the skin barrier or immunosuppression are risk factors. Pretty simple risk factors to keep in mind. They are most often unilateral infections. They occur in the lower extremities. Erysipelas is a superficial infection of the epidermis, whereas cellulitis involves the deeper dermis and subcutaneous fat and may or may not present with purulence. Lab findings are non-specific, just leukocytosis and elevated inflammatory markers like ESR and CRP. So what you need to know here is the most common cause of cellulitis. So the most common cause is the beta hemolytic strep. And among those, the most common is group A streptococcus or strep pyogenes. So streptococcus, it's a gram-positive, non-motile, non-spore-forming catalase-negative cocci that occur in pairs or chains on gram stain. So catalase-negative cocci in grape-like clusters would be one of the staph species, but cocci in chains would be strep. So that's the little bit of differentiation where you guys went wrong, but otherwise you were on the right path. So most strep are facultative anaerobes, while some are obligate anaerobes and require enriched growth media. Strep pyogenes is a group A streptococcus with beta hemolysis. Strep pyogenes is also known to cause other infections, including pharyngitis, scarlet fever, and impetigo. Staph, on the other hand, these are gram-positive, catalase-positive cocci that occur in clusters, and the organism that most frequently causes cellulitis is Streptococcus pyogenes. So just keep this in mind. Cellulitis is Strep pyogenes, and you need to remember that it's not formed in clusters, but it's formed in chains. So if you just remember that much, you should be fine with this question. Okay. And here are some differences between strep and staph. They're both gram-positive, they're both cocci and round, but this was the main thing that I think you guys confused in this question. Staph is clusters and strep is chains. Divisions, staph can be seen in various directions, but strep grows in one linear direction. This Staph aureus is catalase positive and strep is catalase negative. And enriched media, staph does not need enriched media, but strep will require enriched media for its growth.
Thanks for watching. Please give a thumbs up and subscribe for more.